Let me see if we get the mic thing right. Okay. Can you hear me now? How's this? Okay. I tend to move, so you can reel me back if I get too far away from the mic. Okay. There's our official starting bell. I was 14 years old. I'm standing in back of a fence, looking in at a big backyard and a 2-story red house. It's my family home. I think to myself, if I don't understand the meaning and purpose of life, there's no point in going on living. I thought I was having an existential thought, but in reality, it was disordered thinking, the beginning of many years of suicidal thoughts, planning, and interrupted attempts. How do I know that now? Well, a year before, when I was 13, I was really depressed for about 6 weeks. My grades dropped. I remember wrapping my head with a scarf so nobody could see my greasy hair because I just couldn't get motivated to wash it. I had loved participating in all kinds of school activities, and now I didn't even want to go. And 3 years before that, when I was 10 years old, I had cried every day for a month. My mother finally said, "Kerrie, I can't help you." 50 years ago, we didn't understand mental illness in the way that we do now. And in the last 50 years, we've developed many effective treatments. The American Psychiatric Association says that when people are experiencing mental health problems, they often turn first to their faith community. By educating ourselves about mental health and mental illness, we are helping ourselves and our churches. So today, we're talking about the 3 mental illnesses that are the most likely to affect any of us and the people we know: major depressive disorder, substance and alcohol use disorders, and anxiety disorders. And when we're learning about mental illness, it's helpful to start with a definition of what mental health and mental illness are. The Surgeon General of the United States describes mental illness as the successful performance of mental function resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. And the Surgeon General describes mental illness as health conditions that are characterized by alterations in thinking, in mood, and in behavior. So, for example, depression is a mental illness that's characterized by a change in mood. An alcohol use disorder is an illness that's characterized by a change in behavior. An obsessive compulsive disorder, which is an anxiety disorder, is characterized by a change in thinking, that those are the obsessions, and a change in behavior. Those are the compulsions. And the second part of that definition is that these changes, these alterations in thinking, mood, and behavior are associated with distress and or impaired functioning. This is really important. If I hear voices, but those voices don't bother me, I can go to work, I have satisfactory relationships, and I'm able to take care of myself, then it's not a problem. But if I hear voices and that really stresses me out and I can't function in the world, then it would be diagnosed as a disorder. And the Surgeon General goes on to tell us that we have many effective treatments for mental disorders and that we should seek help if we have a mental health problem or think we have symptoms of a mental disorder. And the Surgeon General mentions in the same paragraph that the treatments that we have available for mental disorders today are as effective for those disorders as the medical treatments that we have for physical disorders are. So the World Health Organization says that the third leading cause of disability in the United States is mental illness. And the three illnesses that are at the top of that category are, number one, major depressive disorder or depression, substance and alcohol use disorders, and anxiety disorders. So we'll start with number one, major depression. So in 2016, 16 million adults in the United States had an episode of major depressive disorder. And to put that in context, in some years, that is more people than got the flu. So what are the symptoms of major depressive disorder? It's being depressed or down most of the day, nearly every day, or losing interest and pleasure in things that you formerly enjoyed. A sudden weight gain or weight loss or a change in appetite. Insomnia or sleeping too much. Feeling agitated and restless or having your thinking and movement slowed down. Feeling tired or fatigued. Feeling guilty or worthless. Having trouble thinking, concentrating, or making decisions. Frequent thoughts of death, suicide, planning suicide, or attempting suicide. Someone who experiences 5 or more of these symptoms most of the day, nearly every day, for a period of at least 2 weeks, could be diagnosed with major depressive disorder. And an episode of depression can last for 2 weeks, 2 months, or much longer, even years. Now, you might logically ask, what's the difference between depression and grief? Isn't grief normal? Doesn't everybody grieve when they lose someone they love? That's true. Most people do grieve after a loss, and there are significant differences between depression and grief. When I lose someone, my attention is focused on the person I lost. But when I'm depressed, my attention is focused on me. With grief, my sadness tends to go down, lessen over time. When I'm depressed, my sadness might sort of be static or even increase a little. When someone dies, many of us feel guilty. If only I would have told the person something. If only I would have done something before they died. But grief alone doesn't produce a feeling of worthlessness. And when someone dies, I'm still able to feel happy. For example, when I'm sharing happy memories of my loved one. But when I'm depressed and something good happens, I might not feel happy at all. Or I might feel happy for a little while and then feel sad again. depression affects different groups of people differently. A person of any gender may experience any of these symptoms of depression. However, typically, women tend to experience more depression than men. And the symptoms women tend to experience are grief, sadness, guilt, and worthlessness. Men, on the other hand, typically, this is typical, not always, typically tend to experience more anger, irritability, tiredness. They tend to engage in more reckless activities, substance use. And men don't tend to seek treatment as often for their depression. Older people sometimes have a hard time admitting to grief and sadness. Also, older people tend to have more of the physical illnesses that cause or contribute to depression. And we'll talk a little bit more about those illnesses in a moment. Young children tend to pretend to be sick, refuse to go to school, cling to a parent, or be afraid that a parent may die. Older children and teenagers tend to get in trouble at school, sulk, be irritable, and their depression tends to be combined with other disorders like eating disorders and substance abuse. Now, if you've never experienced the symptoms of depression, you might think, well, why can't people just put on a happy face? We all go through hard times, right? I wish it were so easy. Depression has many, many causes. That's why we're so vulnerable to it. Genes can make some people more vulnerable to depression, and there's a genetic component to having antidepressant medications not work for you. Personality traits can make a person more vulnerable to depression, and personality traits are a combination of genes plus your environment. Brain changes can cause depression, and too much or too little of any of the chemicals that make your nerves fire can lead to depression. Stressful life events can tip the balance for someone who's vulnerable to depression. And early life trauma, studies have shown that early life trauma creates lasting physical and emotional consequences that can make a person vulnerable to depression later in their life. The change in light, having less daylight can make some people prone to depression. This is called seasonal affective disorder. And medical illnesses or medications cause up to 10 to 15% of all depressions. And I'll tell you what some of those illnesses are. Hyper and hypothyroidism, endocrine disorders, too much or too little of any of those many hormones that run our body processes, heart disease, neurological degenerative conditions like Alzheimer's, Huntington's, multiple sclerosis, Parkinson's, stroke, nutritional deficiencies such as a lack of vitamin B12, certain immune system diseases like lupus, some viruses and other infections such as mononucleosis, hepatitis, HIV, cancer, erectile dysfunction in men, circadian rhythm disorders, giving birth, you've probably heard of postpartum depression, and medications. Depression can be a side effect of medications. It can be the result of a change in dosage of medications. It can also be the result of medication interactions. That's a lot of reasons. So finding the cause of your depression can be a little like peeling an onion to figure out what it is. For some treatments, knowing the cause is important, but for other treatments, it doesn't matter. So how do we go about getting treatment if we're experiencing symptoms of depression? It's always good to start with a regular medical checkup. With all these possible medical causes, you would want to know if something is causing your depression. If you're suffering from seasonal affective disorder, light therapy might be helpful for you. It's always wise to visit a psychiatrist who might prescribe antidepressant medication for you. There are a number of therapies that have been demonstrated by research to be effective for depression. And 3 of those therapies are cognitive behavioral disorder, interpersonal therapy, and problem-solving therapy. With cognitive behavioral therapy, what we do is you work to change negative thinking. Cognitive behavioral therapy also helps you to identify behaviors that may be contributing to your depression and change them. Interpersonal therapy helps a person to understand and work through relationships that may be causing their depression. And problem-solving therapy uses a step-by-step process to help you come up with realistic solutions for stressful life situations. And problem-solving therapy is especially helpful for older people and young adults because these groups of people tend to be going through large transitions in their life at that time. Antidepressant medication plus therapy appears to be more helpful than antidepressant medication alone. Therapy, though, may be adequate for some people. There are some internet therapies now that are showing promise as being helpful for some people. If you have a circadian rhythm disorder, you can get treatment with a psychologist or a sleep medical center. If you're experiencing a severe depression or you are at risk of self-harm, you may need inpatient treatment for a while or to participate in a partial hospitalization program. If you're experiencing a severe depression that is medication resistant, electroconvulsive therapy, or ECT, may be very helpful for you. ECT today is not like ECT in the movies or the old days. It's done under anesthesia, and they use muscle relaxants. And if you're experiencing depression that is resistant to all the forms of treatment that we've talked about, there is a newer therapy that may be helpful for you called brain stimulation. There are some what we call complementary therapies. These are over-the-counter remedies, nutritional and herbal remedies that you may see advertised. None of these has been shown so far to be helpful by itself for depression. Some of these have shown limited effectiveness in combination with other treatments. There's one that I want to point out to you, and that's St. John's wort. And the reason I'm mentioning that, it's a somewhat well-known herbal remedy for depression. It can be detrimental in combination with certain medications. So if that's one you would like to try, it would be wise to check with your medical practitioner first for drug interactions. And self-care is a vital part of treating our depression. It's important to educate yourself and learn what you can about depression, to spend time with your loved ones, to exercise, especially aerobic exercise, to eat well, and to practice good sleep hygiene. And it's important to be patient. Recovery from depression is possible, and it will take time. So now we're going to talk about substance and alcohol use disorders. But first, class, I'm going to see if you did your homework. Homework? What homework? My assistants are passing out a pop quiz and pencils. You have 5 minutes, and if you don't have time to answer all the questions, be sure to answer question number 5 and question number 10. All right, put your pencils down. This was just, remember the mic. This was just for the fun of it. This is a quiz designed for teenagers by the National Institute of Drug Abuse, or NIDA. It's part of the National Institutes of Health. And all of the answers and full explanations are on the back. But don't look at it yet because we're going to talk about two of the questions. So question number 5 reads, there have been a lot of news reports lately about people overdosing on prescription pain relievers known as opioids. How many people died in the United States in 2015 from pain reliever overdoses? How many people said A, B, C, D? Well, actually, the answer was C, 22,598. However, that's not quite accurate because that's prescription. 13,000 people died from heroin overdoses, and heroin's a street opioid, which brings a total to 35. And I'm sorry to say that in the last few years since this statistic was added up, the number's up about 10 to 15 more thousand. And question number 10, about how many people age 16 and older say they have driven after taking illicit drugs? How many people said A, B, C, D? The answer actually is D, 12 million. So forget about not driving because of climate change. If there's anything that makes you want to take BART or public transportation wherever you are, it's all the people on the road who aren't sober. So there are many different symptoms of substance abuse disorder. It all depends on the substances being used. All of the symptoms include thinking, what we learned about earlier, thinking, mood, and behavior, along with tolerance and withdrawal. And there's one part of the definition that holds across all substance and alcohol use disorders. And that's that substance and alcohol use disorder involves continuing to use substances in spite of negative health, financial, relationship, work, mental, and/or legal challenges. I'll say that again. Substance and alcohol use disorder involves continuing to use substances in spite of negative health, financial, relationship, work, mental, and/or legal challenges, or consequences, sorry. So we know what the consequences are of substance and alcohol misuse. The question is, why is it so hard to stop? Some of you will remember this old television ad from the 1980s. It's called, "This is Your Brain on Drugs." Video, please.
Okay, last time. This is drugs. This is your brain on drugs. Any questions?
40 years ago, we thought we could scare people into quitting. In the last 40 years, we've learned a great deal about addiction. So now I'm going to play you a 4-minute 2017 version of This Is Your Brain on Drugs. This one is by National Geographic, and it talks about the neurobiology of substance use, misuse, and addiction. Video, please.
What are your fiercest cravings? Whether we're ducking out for a smoke, going for glory at the blackjack table, or drowning our sorrows in a glass of wine, we all have ways that we seek to push our pleasure buttons. But what happens when this need for pleasure becomes a full-time pursuit? When our fix turns into something more like a dependence? Used to be that addiction was considered a sort of moral failing. But now, with a much better understanding of how the human brain works, scientists are learning new clues about the vicious cycle of desire, binging and withdrawal that traps tens of millions of people. Our brains evolved a reward system based on a chemical called dopamine. This amazing neurotransmitter creates cravings in us to encourage behaviors that help us survive, such as eating, procreating, or interacting socially. In turn, pleasure is then stimulated by other neurotransmitters in hedonic hotspots of the brain. When dopamine's craving circuitry overwhelms the pleasure hotspots, addiction occurs. Essentially, your reward system is hijacked. Let's break it down this way. Your desires are triggered when dopamine, starting at the top of the brainstem, travels through neural pathways to affect the brain. Drugs increase this flow of dopamine. Where does the dopamine go? It flows throughout the brain's craving circuit, including the dorsal striatum, where brain nerve cells called neurons begin to form habits by IDing fun things that you've done, like buying drugs or cigarettes. Dopamine also goes to the prefrontal cortex, where with the help of an amino acid called glutamate, rich visualizations that cue cravings are conjured. Think images of drug paraphernalia, sex, or a bottle of booze. Then there's the amygdala, where the dopamine causes neurons here to be stimulated by learned emotional responses, like rich, pleasure-coded memories. So what happens when drugs artificially flood these pathways with dopamine? For one thing, the rush can rewire your brain to want more drugs, and thus create addiction. But it turns out different drugs interact with the reward system in unique and interesting ways. Cocaine, for example, blocks dopamine transporters and prevents the removal of excess dopamine from synapses. Methamphetamine, on the other hand, floods the terminals of neurons, displacing dopamine into synapses instead. And heroin blocks dopamine inhibitors, causing synapses to flood with dopamine without restraint. The good news? With a refined understanding of the devastating effects of these drugs comes new angles and approaches to the treatment of addiction that have shown remarkable promise. Cocaine addicts have been able to shut off their cravings abruptly when electromagnetic pulses are applied to their prefrontal cortex. A drug hitherto used to treat muscle spasms called baclofen has shown promise for treating alcohol dependence. As more and more of our friends and family are affected by crippling addiction, it's comforting to know that we are finally finding effective ways to take our brains back.
Video end. Okay, great. So the good news is that we now recognize that addiction is an illness, and all marketplace plans cover substance and alcohol use disorder treatment. In the packet that I gave you today, you have 2 sheets. The first one says in the left corner, SAMHSA, that's the Substance Abuse and Mental Health Services Agency. And this is a really excellent guide to getting good treatment. It talks about your steps to accessing care, and then it talks about how do you know what good treatment is. Substance abuse affects every aspect of a person's life: relationship, financial, health, mental, legal. So every aspect of a person's life needs to be treated. And that's why it's so important to identify a program that's going to be a good program for you or someone you're trying to help. And this next sheet is by the NIAAA, which is the National Institute of Alcohol Abuse and Alcoholism, which is part of the National Institutes of Health. These agencies are all tax funded, so you've paid for this. And this sheet is called the Alcohol Treatment Navigator. And it does for alcohol treatment what this other sheet does with substance abuse. It helps you to evaluate your own use and to find good treatment if you would decide that's something that you or someone that you love is needing assistance with. You also have in your packet a booklet called Rethinking Drinking by the NIAAA. And this booklet, the first half of it, helps you to evaluate your own drinking and make a decision. Is it fine, or might you need to cut down or quit? And the second half of the booklet has a number of strategies for cutting down or quitting. And many people have, and research has shown this, many people have been able to cut down or quit their alcohol use even without treatment. It's really important that we teach teens about substance and alcohol use, and this is why. If you try your first substance before you're 17 years old, or you have your first drink before you're 20, you are 4 times as likely to develop an addiction in your life. So we're not saying don't ever try a substance, don't ever drink. But if we can convince young people to wait until they're 17 to try substances and 20 to try alcohol, their chances of not developing an addiction in their life is so much greater. And a slide I accidentally skipped was that 14 out of 100 of us will develop a substance or alcohol use disorder in our lifetime. That's a pretty high number. So just getting kids to wait a little bit could make a huge change in bringing those numbers down. So now we're going to talk about some normal everyday parts of life that we all experience, like worry, stress, overwhelm, anxiety, panic, fear. Okay, those are all normal emotions, right? We should just be able to squeeze our stress ball and get on with it. Okay, tell the truth. How many of you experienced just a little bit of anxiety when I said we were having a test? Anybody? Okay, we all know what that feeling of anxiety is. When I was young, I participated in a sport in which I had to go out and perform by myself. I would get very nervous. I would get so nervous that I would shake. And people would say to me, just relax. Don't worry. Don't be nervous. How much do you think that helped? Yeah. So, more than 40 million adults in the United States have an anxiety disorder, and it is the most common mental illness in children. So, what are the anxiety disorders? There are a lot of them, so I'm going to explain what some of the most common are. So, generalized anxiety disorder. This is where a person experiences worry and anxiety about just everyday things in life, but a whole number of everyday things, most of the day, for at least 6 months. Obsessive compulsive disorder. This is where a person experiences unwanted, obtrusive thoughts, those are the obsessions, and ritualistic, repeated behaviors, those are the compulsions, which exist for the purpose of bringing down the anxiety of the obsessions. I'll give you an example. In this photo, a person has their obsession is that every time they touch a doorknob, they get a germ that is going to make them ill. And this is so stressful that what they do to cope with it is they wash their hands every single time they touch a doorknob in the entire day. So if this thinking about these germs and washing their hands takes up at least an hour a day, the person might be diagnosed with obsessive compulsive disorder. Panic disorder. So a person with panic disorder experiences panic attacks. Panic attacks are unpredictable attacks that come on without any warning whatsoever. And they come on all of a sudden. Within 10 minutes, you go from baseline no anxiety to your highest level of anxiety. And there are a whole number of symptoms that you might have different ones of. For example, you might have pain in your chest, trouble breathing. You might feel like you're having a heart attack. You might have nausea. You might have cold sweats or hot flashes. You might be filled with fear, like I'm going to die. You might feel this sense of being disconnected from yourself. And a person who has panic disorder worries that they're going to have another panic attack because they're not predictable. Post-traumatic stress disorder, or PTSD. This is where a person has either experienced, been threatened by, or witnessed a trauma that could bring great harm to either themselves or someone else. And there's a whole constellation of symptoms that go along with PTSD. And these are symptoms such as you could have flashbacks, and that's where something in your environment brings you a memory and suddenly you are completely back in the situation. You could have nightmares, trouble sleeping. You could have various physical ailments. You could lose your sense of the future, like you can't see your life going on. Now, many people experience traumatic events in their life, and not everyone gets PTSD. There are a number of factors that make people vulnerable to getting PTSD. Social anxiety disorder. So how many people here feel even a little bit of anxiety when you know you have to speak in front of people? Most of us, about 90% of us, feel nervous if we're going to speak in front of other people. So when does that become a disorder? Well, if you really want to give a toast at your best friend's wedding, but you can't get up, or you're really lonely, but you can't bring yourself to introduce yourself to other people or go to a social gathering where you might meet people, then you might want to get help. And there are a number of specific phobias, actually for a large number of items. And a specific phobia is where you experience unrealistic fear in the presence of or in anticipation of an object, a place, or a situation. And some examples of specific phobias are fear of flying, fear of heights, fear of snakes, fear of spiders. So again, when does this become something that you get treatment for? Well, I had a neighbor come and get me one day because there was a daddy long-legged spider in the laundry room, and she needed me to get it out of the laundry room so that she could do her laundry. So as long as you have friends and family who get the spider out of the bathtub or out of the laundry room, maybe it's not really a big deal. But if there's something that you want or need to do in your life and you can't do it, then you might want to get treatment for that. And there's very effective treatments for anxiety disorders. Some of the same treatments that are helpful for depression are also helpful for anxiety. And especially cognitive behavioral therapy, which we've talked about, is helpful for anxiety disorders. And one type of cognitive behavioral therapy, which is called exposure therapy, is especially helpful. And what exposure therapy is it's exactly what it sounds like. It gradually exposes you a little bit at a time to what you're afraid of. And when I say that, I see a whole bunch of people make a face. And that's why it says medication and therapy, because some people may need to take medication to lower their anxiety enough to be able to begin to face what they're afraid of, so they can work in combination. Remember that onion? Today, we talked about major depressive disorder, substance and alcohol use disorders, and anxiety disorders. Oftentimes, these appear in combination with each other. For example, if we peel away the substance use disorder of the onion, we might find that we were using substances to cope with the anxiety or the depression that's inside. We are complicated beings, and healing is not a linear path. As we peel the layers away, more will be revealed. Yet with faith, support, and good treatment, recovery is possible. And now we have time for questions. It was called brain stimulation therapy. His question was, what was the treatment mentioned after ECT? It's called brain stimulation therapy.
Were you saying that that one is even more, that's a treatment of last resort even more than ECT?
Right now it is.
Why is that?
I think probably because it's new and it's probably very expensive and not as nearly as available. Yeah, harder to find. Yes.
Yeah, with my mental illness,
Mm-hmm. Mm-hmm.
self-mutilation. I'm still suffering from self-mutilation, and sometimes, what it is that I will peel back my skin and then rub hot water or something to give me more pain. I used to abuse aspirin because it tasted like candy and it messed up my lining. I also would take about sometimes 15 baths a day because that was comfortable for me. That was my escape from when I was in the hospitals and stuff like that. I don't do it as often. I used to purge. I gave up the Seroquel. I used to purge and purge and purge and eat and purge and then drink water and eat and purge again until, I have to come to church and beg for money or some food because I didn't eat everything, And some of it I understand where it stems from my childhood and stuff like that. I was not allowed to be a child when I was growing up. And I learned how to accept abuse, physical abuse, And then when I was in the hospitals and stuff, I was being sexually violated and abuse and more abuse. And, till I couldn't function in the real world unless I was in the hospital, having somebody take care of me where I can get the help that I need, but thought I could get, but they turned around and abused me too. So, with all of this, I'm running into a lot of people that have similar illnesses, and I'm starting to understand more. And when they snap at me, I say, well, I have to understand what they're going through. And sometimes I have to give them a time out and then come back later and see if we can solve the problem. But this is an ongoing process. And I am just so grateful to all of you. I consider all of you my family, my teachers, my loved ones. And that's where I'm going to stay. And I'm going to get that help. And, God never promised us a rose garden. So I'm fighting every day, even in my sleep. So, and I have a little pain from people hugging me. If they see my back, where I take forks and just, because I want to go in that shower and make it as painful as possible for myself. And I'm getting these stories out, and hey, but I still love me, but see, this is good right here. The heart's good. It's something up here, and I'll take on the world of the pain of the whole world, I have the biggest pity parties, but I know how to run back to a safe place for me, and that city of refuge, that's my God, and just know joy is a big part of it. I have to run and get me some joy. So I want to really thank all of you, because this is healing me, and maybe I can go out and heal some other people just by being present and listening. That's the key thing, listen. And sometimes my issues have issues, okay?
What's your name? Mother Jones. Thank you so much for your sharing. And my heart goes out for all that you have suffered, and thank you for sharing how your suffering has turned into compassion for other people. That's an example for all of us to follow.
When Mother Jones says my issues have issues, it's similar to what I thought. We all know, well, maybe we don't, but we all know the story of the Good Samaritan. And that was obvious. He was beaten up, or she was beaten up, and the Samaritan. And as a result, we know the word Samaritan, at least in our tradition. But what if it's not so obvious? You get an inkling, and you're busy, and you're going on. What the inkling could be serious? For example, the single mother that you might have suspect has been drinking when she picks up her kid from school by herself, or kindergarten. Anyways. That's a very general question. But
what seems like your question is something that I heard referred to this morning when Amy was talking, especially about disorders that don't always show on the outside in the moment. How can we open, Randy, it seems like your question is, how can we open our hearts? What can we do if it's not so obvious? And I think educating ourselves, and as Sarah said, having compassion in every moment, knowing that none of us knows what everybody else is going through, really. There's so much that maybe we don't see. And hopefully as we share more and more, we'll become more transparent as we let each other see who we are. We can help.
So I have a question about depression. And it's often associated with a physical decline, like physical chronic conditions. Is it the imbalance itself that causes those other physical conditions, or is it the behavior and the way you treat yourself or mistreat yourself resulting from the depression that causes the associated disorders?
Did you all hear the question? Okay. That's sort of a chicken and the egg question. And I think it's really, to the best of our understanding today, it's both. Because there are lots of physical conditions, as we've seen today, that can trigger depression in the body. There are lots of things that we do as a result of depression, behaviors we engage in, to deal with our pain, when we're hurting. As Mother Jones was sharing, we may try and do some behaviors to make that pain go away. And so then it snowballs. So it's both. So that's when we say that it matters for some treatments to know the cause and for other treatments not. But we have to treat it all. Not all at once, because we don't figure it all out. We peel away the layers of the onion, and as we peel them away, then we can treat them.
I just very appreciated that you pointed out one of the aspects of addiction. People don't think about the fact that, and I heard this in a group setting, which really kind of, it's like you think you know, but then somebody says it, oh, now I really get it. And the idea that the compulsive behavior is not the issue, because once you start to contain the compulsive behavior, then you start to realize there's other things that are causing all this compulsive behavior and not things that you thought were causing it. But there's a difference between that two things. So I appreciate that, because it's really, people don't understand that a lot.
Yes. We are complicated beings.
My question is, how do you address some skeptical folks when it comes to treatment? For instance, that there are medications for depression that can depress you even more.
So your question is how to let someone know that you or someone that you know is going to be taking an antidepressant medication, or how to tell people about antidepressant medications when they don't always work, or did I hear that accurately? What do we tell them because they're skeptical? Well, that's a little tricky, but if you think about medical illnesses, your doctor doesn't always hit on the right medication first, right? Sometimes they have to try a different medication to get something. Sometimes they have to try a different dose. Even with, and there's really no separation between physical and mental, illness. It's all part of a whole. But for our physical side of those disorders, we try lots of different things. We don't always know. And it's the same thing with taking medications for brain disorders. We don't know exactly, because there's not a blood test we can take that says, well, a little bit of dopamine's going to help you, or a little bit of serotonin, upping your serotonin is going to help you. You just have to try it. So, and like with medical disorders, physical disorders, sometimes you try a treatment and it doesn't work. The doctor can never promise you it's going to work. They can only do the best they can do.
I think we're trying to understand our son who has depression, obviously. One of the things he has done, and I think this is a coping mechanism that doesn't hurt others, but he has taken on receiving suicide calls, and he's become known. People will call him in the middle of the night, and he talks them through it. And I near as I can tell, that's just his way of coping with his own depression. It's kind of scary to think of him giving advice, but that's what he does.
So it's a little frightening for you, the idea, you're a little worried about what he might tell someone, because he experiences suicidal thoughts himself, and yet he finds support by helping others.
Basically telling them how beautiful life is.
Maybe he's telling them until he can convince himself. Maybe it's his way of helping others. And there is one kind of, 2 minutes? It's 2:00, got it. I'll finish answering this and then we're done. There's a type of therapy that has been developed that is sometimes used for depression as well. It's called dialectical behavior therapy. And in DBT, one of the skills that people learn to deal with their distress is to sometimes lose themselves for a while in helping other people. So sometimes that's it. Sometimes after we've said it enough to other people, it starts to sink in for us. Yes. Thank you so much for your attention today.